Okay, so we're back again. And next out is a colleague of mine, Dr. Phuong Dinh received his PhD degree in mechanical engineering at the Purdue University in the USA. And you came to our research center in Tromsø in 2019. Phuong's research areas focus on robust and safe artificial intelligence using machine learning and control theories. So now I welcome you to the floor. I look forward to your presentation. And as always, if you have questions, please write them in the Q&A.
Thank you very much, Erin, and thank you very much for letting us me presenting, representing the impact groups and present our project today. Yes. So the our project's name is impact, which stands for person-centered predictions of benefit for multimorbid patients. So as you see from the titles, we focus on multimorbid patients because these are the group that we are interested in. There is no formal definitions of what multimorbidities is, but the most common understanding of multimorbidities is defined as patients who has 2 or more chronic conditions. So the number of patients with multimorbidities is rising as a consequence of growing longevities as well as growing populations. So there's also a challenge in managing multimorbidities because we usually manage each conditions as a single disease. However, this approach usually creates interactions between treatments, and also at the same time, guidelines on how to manage multimorbidities are lacking. Here in Tromsø, we work closely with the patient-centered team, PAC team for short, at the University of Northern Norway. They offer services according to current guidelines for multimorbidities, person-centered care, which emphasize shared decision-making, integrated care, where professional plans across conditions and disciplines. This is also one of the important properties of the PAC care is it is a proactive care where we seek to prevent clinical crisis. And the PAC methods has been shown to be able to reduce emergency care, increase planned care, and reduce mortality by 40% compared to a control populations derived from a propensity score matching approach. So does that mean that we should provide the patient-centered care or PAC care to all multimorbid patients? The answer is no, because the PAC care is expensive, and there is also a lack of variations of who benefits most from their care. Therefore, PAC service should be offered only to those who benefit most from their care. But how do we identify the patients that we expect that will have the highest impact of patient care? So multimorbidities is existing, and the patient with multimorbidities exist. The treatments and outcome of these patients are typically recorded in an electronic health record, making it a valuable source of evidence for understanding and managing multimorbidity. So by analyzing EHR data, researcher and healthcare professional can get insight into the prevalence of multimorbidity and the most effective treatment approach. In addition, leveraging the EHR data can lead to improved outcome and better quality of care for patients with multimorbidity. So our research questions are, which patients are predicted to become future high-need and high-cost patients? The first questions will focus on predicting which patients are likely to require higher level of healthcare resources in the future, which allowed the healthcare system to intervene early and prevent costly events. The second questions is which patients have the highest benefit from PAC services? So the second question to identify the patients who requires the most resource, which desire to provide, coordinate, and patient-centered care. So by answering these two questions, we can optimize resource allocation and improve patient outcome. So our objective is to design a knowledge-based AI system that can solve the challenge in multimorbidity care. And here are the three most important properties of such a knowledge-based AI system that we aim to develop. First of all, it has to be comprehensive and acquire accurate knowledge representations. So by building a comprehensive and accurate knowledge base, we want to gather information from diverse sources, including domain expert articles, clinical guidelines, and electronic health records. The second important property is the AI system has to be able to be continuous learning and adaptive. It has to continuously refine the knowledge base and reasoning mechanism through machine learning and other techniques, be able to incorporate new information and adapt to the changing environment. And it also has to be able to provide good explanatory abilities and transparencies. So the AI system is expected to provide clear explanations and justification for the AI system conclusions, recommendations, or actions so that it can promote trust and understanding among users. So the most important or the core methodologies in our AI system, we use fuzzy logics. It was developed some time ago. It was introduced to represent heuristic informations as a fuzzy rule to map input to output. It is a mathematical approach that allows for uncertainty to be incorporated in the decision-making process. It can represent knowledge that is not easily quantifiable and can take into account multiple variables and conflicting informations. This approach can make more informed decisions by incorporating expert knowledge into the decision-making process, especially in situations where data is incomplete or uncertain. So unlike Boolean logics, Fuzzy logics is a form of many value logic in which variables have truth values defined by a membership function ranging from 0 to 1, or absolutely false to completely true. For example, the fuzzy membership functions in this figure describe the linguistic variable family support. Here, family support is expressed as by the linguistic variables low, medium, and high in the form of membership functions between 0 and 1. So due to the uncertainty in the knowledge, for example, 5 hours per week of available family care will be considered, in this case, both partially low and partially medium. So a fuzzy system is a system that is used to reason and make decisions or predictions based on a repository of fuzzy expert knowledge. The main components of fuzzy system are a fuzzifier, a knowledge base, and an inference engine, and a defuzzifier. So the fuzzifier transfer crisp or actual input to a fuzzy membership function, identify its degree of membership to a vector concept. The inference engine provides fuzzy system decision-making logics and calculate the output using fuzzy implications and fuzzy rules of reference. The defuzzification process transforms fuzzy action into a crisp amount. So one of the challenges the developing fuzzy logic system is to be able to obtain the necessary knowledge. The original fuzzy system is derived or developed with only including expert knowledge. But obtaining this information can be very difficult and time-consuming, particularly in complex domain where multiple experts is required. So to address the challenge, we are developing other approaches using we're using fuzzy neural network and natural language processing to be able to automate the process of obtaining this expert knowledge, so that we can gather heuristic rule automatically from structured data and unstructured data. I'll go more in details in the next slides. So a little bit introductions about neural network. Neural networks are sets of algorithms that are modeled after human brain. They are designed to recognize patterns and learn from data. And deep learning is a subset of machine learning that use neural network with many layers. So they allow network to learn more complex features and patterns in the data. And it has been used in many applications, such as image recognition, natural language processing, and autonomous vehicle. And the combinations of fuzzy logics and neural network create what we call a fuzzy neural network, which is a form of fuzzy system that employs neural network made of fuzzy neuron. So it combines the advantages of neural network with fuzzy logics, resulting in a powerful hybrid tool. So the model is able to capture and integrating the management of uncertainties and interpretabilities offered by fuzzy system with the learning ability provided by the neural networks. Furthermore, the combinations of the neural network and fuzzy logics was intended to evaluate the shortcoming of this system, resulting in a more efficient, resilient, and easy to understand system. Also, in this project, we also explore natural language processing techniques to extract knowledge from clinical tasks. So natural language processing, as you know, is a powerful tool to extracting logical rule from clinical notes. We will focus first to identify, be able to identify clinical relevant entities, and then identify the relationship between them. The goal is to automatically represent this knowledge using a repository of logical rules. On the right-hand side is just extractions of clinical text from a paper, academic papers, and using NLP, we can identify the most important clinical entities, and then the green color, green highlighted words shows the relationship between the entities. So we can use natural language processing to extract this types of knowledge and be able to represent this into a standard heuristic rule, so that fuzzy logic system can use for inferencing mechanism. One of the most important aspects of the projects is we will define an impactability score. So impactability is defined as the difference in outcome due to treatment modifications. The impactability score needs to have causal implication, and it has to be able to capture the uncertainties in the data and the process. And impactability score are usually measures by quantified by two different types of measurement, either relative effect measures, which is the ratio between two incident outcome, or a simpler version is the risk of outcome, the ratios in risk of outcome between two different treatment options. Impactability score is also measured by the absolute effect measurement, which is the difference between two incident proportions, or the difference in risk outcome between two treatment options. So here is an illustrations of how the impactability score is calculated using absolute effect measurement, and can be used in the referral process. First, a machine learning-based prediction model that is a combination of fuzzy logics and neural network. It's built based on EHR and text. So when a new patient is reviewed, the system will make predictions of a chosen risk of outcome. Here we choose the properties of 1 year survival for 2 scenarios: if the patient received the care and if the patient does not receive the care. The difference between those 2 risk measurements are the impactability score, which will be used as a basis for the referral decision process made by the clinicians and the patients. So at the end of the project, we are looking forward to a validations and usability study. This study can be divided into 3 different processes. First, the first study will be more related to the clinicians. We will ask the clinicians through a set of questionnaires about the user interface, the credibilities of the AI system, and what is the implication for GPs and the system. In the next phase, we focus more on the patients. We will have dialogue with the patients and to see how does this support the shared decision-making process between patients and clinicians. And then how did the clinicians support the patient in understanding, listening, and including what mattered to the patients in choosing what to do next. And the final will be a well-designed RCT to be able to compare the referral process between our impact models and the normal referral process that is currently used. So the expected impact of the projects, we have different types of impacts. Firstly, for the multimorbidity patients themselves, the system is expected to improve the care outcome by optimizing care services and the referral process. By ensuring that patients receive appropriate and timely care, the system can lead to improved health outcome and quality of life for these patients. In addition, the system is expected to benefit clinicians by reducing the resources required at the referral points, by providing clinicians with accurate and comprehensive information about patients. The system can help to streamline care process and reduce the need for unnecessary referral or test. Finally, the project envisions an increased use of preventive and planned care, as well as reduced services of emergency or costly care due to improved multimorbidity care. By enabling the healthcare system to identify and manage patients with multimorbidity more effectively, the system can help to reduce the burdens on emergency department and other costly healthcare service, ultimately leading to more efficient and effective use of healthcare resources. So in overall, the expected outcome of the system are improved patient outcome, increased efficiency for clinicians, and more effective use of healthcare resources for the healthcare system as a whole.